Wherever you are right now, good morning, good afternoon, and good evening, world. And to all of my avid followers, my new followers, my Facebook friends, all my ABS-CBN kapamilyas, all my relatives, my kumares, my kumpares, mga kinakapatid ko, my friends, and all my colleagues in the entertainment industries, my co-doctors, my friends and colleagues in the fashion industries, all my college friends in the US, my co-workers, my staffs, my patients, my co-rotarians, and all my clients, and to everyone that are watching right now, welcome to my show, Let's Talk with Doc Yammie Santos. Again, I'm Doc Yammie Santos, your clinical mental health psychologist and therapist and host for tonight live streaming show, Let's Talk. Um, sa mga tao hindi pa nakakilala sa akin, I'm Doc Yammie Santos. I used to have a show at ABS-CBN, DCMM Teleradio every night, Monday through Saturday. And the title of that show was Love Lives. And now I'm doing my own live streaming show called Let's Talk with Doc Yammie Santos. Please like and share this live streaming for us all to support and to continue to help and guide people with stress issues, emotional, clinical, mental health issues. No? This is our way of reaching out to everyone who needs guidance and support on how to deal with their stress issues, emotional concerns, psychological issues, social, sex issues, clinical mental health issues, mga LGBTQ issues natin dyan, relationship problems, behavioral concerns, identity crisis, debt issues, grief, and abusive issues. No? I'm doing this show for me to share and extend my help to people who are not able to seek help or support for their clinical mental health problems. No? I also have a fan page, Doc Yammie Santos, Let's Talk. To all of my viewers abroad and here in the Philippines, you may also text me on my Globe and Viber number, which is 0917-520-8435. And you could also direct message me on my Facebook account, which you already know, Yammie Santos. And also, you could tune into my YouTube channel, which is Doc Yammie Santos. No, this show is actually not my show. No, this is our show. This show wouldn't be here without all of you to support me. Kaya show natin kung lahat able for us to help people with clinical mental health concern, and this is also for clinical mental health awareness. No? This pandemic surely affected the entire world. In a split second nga lang eh. Wala sa ating lahat saw this from happening or coming sa ating mga buhay. We all had our plans, our future dreams. Some of us, and most of us for sure, even had plans on going on vacation, buying a house or buying a new house, buying a car, attending to a family reunion or gatherings, going to business agendas, and trying to live our dreams, no, day to day. Because of this COVID-19 or what we call pandemic, and now meron pa tayo ngayon, Delta, I'm sure it has an intense effect in our lives, no? Such as our emotions, our psychological views, our health, our social life, our morals, our values, our outlook in life, our mental well-being, our physical attributes, our relationship with people and with our loved ones, and our outlooks with our self-perception. Um, there's no exception to who will be infected with this COVID-19. Because of this coronavirus or Delta virus, our world turned around. We were all caught flat-footed by surprise. Um, wala itong pinipili. It can be anyone. No riches, no poor. Any status in life. Any age, any religion, any gender, or any race was not spared. Everyone was affected and can be infected by this invisible enemy. COVID 19 is not the only problem people are experiencing today. Because of this pandemic, I'm sure lahat tayo are suffering from stress, feeling anxiety, depression, unlove, emotional and psychological pain, as well as physical pain, torture, emotional hurt, mixed personal and social conflicts that we cannot control, can't understand, and can't explain, and even can't find a solution to it. Diba? Hope is what we have. Hope is a renewable option that we have. If we run out of hope at the end of the day, but we can get to start over again in the morning and the next day after that. This pandemic has definitely halted normal life and the people across the globe, and we're still fighting it. In time of this crisis, at times we just need a person to talk to. For us, just to shout out our feelings and concerns, whether it's good or bad. Someone to help us think and assess our inner thoughts. Kaya please join me. Let us all relax and shout out all our concerns sa Let's Talk with Doc Yammie Santos. Again, this is not my show. This is our show for all of us to reach out to people who are not able to get help with their emotional concern, psychological concern. And this is also a mental awareness. Okay, before I start with our show, gusto kong batiin dito si Amped Amorsolo. Hi Amped, thank you for watching and thank you for your support. Si Chato de Lara Messina is watching. Hi Chato, hi Mare, thank you for watching. And si Let Medina is watching. Hi Let. Let Medina Pedida is watching. Hi, thank you for your support and thank you for watching. No? I'm gonna gather some mga messages pa natin dito. While I do that, I'm gonna play a song just for a breaker lang, no? Para may konting relaxation naman tayo. Hindi puro salita. Okay, hold on. Tell me when will you be mine? Tell me cuando we can share our love divine. Please don't make me wait again. When will you say yes to me?
When will you say yes to me?
Tell me cuando.
Tell me quando.
Again, this is a very casual um, talk show, so just let's just all relax. If you have any message, yung mga nahihiyang mag-message directly, you could privately message me on my number, which is 0917-520-8435. Again, 0917-520-8435, or you could private message me on my messenger account. No? Let's see here. Si Nicole Yoke is watching. Hi Nicole, thank you for watching. Sabi ni Nicole, good evening po Doc. Good evening. Ni po pa, I feel so old. Saka si Let Medina Pedida. Sabi dito, hi Doc Yammie Santos. Good evening. Watching here from Dasma, Cavite. Hi mga taga Dasma, Cavite. Good evening to you all. Si Ares David Del Rosario is watching. Hi Ares David Del Rosario. Thank you for watching. Si Les Castillo. And also si Chato de Lara Messina is watching. Hi Les and also Chato, thank you for watching. Okay. Yung mga hindi ko pa nababati dyan, just bear with me kasi due to the internet no, minsan na late dumadating. Kaya ang iniintay ko muna lahat pumasok para sabay-sabay kong i-greet kayong lahat. Tagalog ko, no? Para sabay-sabay i-greet ko kayong lahat. Okay, let's start with the show, our show actually. A feeling of worry, nervousness, or unease, typically about an imminent event or something with an uncertain outcome. Desire to do something, typically accompanied by unease. A nervous disorder characterized by a state of excessive uneasiness and apprehension, typically with compulsive behavior or panic attack or attacks. A sudden and intense episode of fear. It is like being followed by a voice. It knows all your insecurities and uses them against you or us. Not being able to sleep because you said something wrong 2 years ago. And I can't stop thinking about it up till now and up to now. A feeling of like everybody secretly hates me. I get nervous about everything. Sometimes I literally don't know why. I'm anxious. I'm, I just am, and no one seems to understand that. It keeps me from enjoying things as much as I should. It is the most silent, painful experience. It makes no sense. And I sit alone and suffer for an unknown reason. I can't explain it. I can't stop it. It's a horrible feeling. I'm terrified that even if I try my hardest, I still won't be good enough for anything. My body thinks something is gravely wrong, but my brain doesn't have a clue what to do about it. So it starts racing to the worst possible conclusion. A feeling like something wrong is about to happen, even though everything seems fine, and I have no actual reasons to worry. A pressure on my chest that makes it hard to breathe, and I can't get rid of it. My worries pretend to be necessary, but serves no useful purpose in my life. People think I'm weak. The fact is, they just don't know how strong I am struggling every single day to stay alive. My worries does nothing but steal my joy and keep me very busy by doing nothing. Our topic tonight is a type of mental health condition called anxiety disorder or panic attack. Okay. Ito yung mga sinabi ko itong introduction ko, ito yung mga nararamdaman ng mga tao with anxiety disorder or nagkakaroon ng panic attack. Okay? May mga message na tayo rito, i-gather ko ngayon sila, no? Mga pumapasok sa account ko rito, may mga question na. While I do that, I will play another song. Okay? Just while you wait, may tugtog tayo. Okay? Hold on.
Hit the road, Jack. Don't you come back no more, no more, no more, no more. Hit the road, Jack. Don't you come back no more. Hit the road, Jack. Don't you come back no more, no more, no more, no more. Hit the road, Jack. Don't you come back no more. Oh boy, don't you treat me so mean. Meanest old boy I have ever seen. I guess if I say so, you got to pack your things and go. Hit the road, Jack. Don't you come back no more, no more, no more, no more. Hit the road, Jack. Don't you come back no more. Hit the road, Jack. Don't you come back no more, no more, no more, no more. Hit the road, Jack. Don't you come back no more. No, baby, listen, baby, don't you treat me this way, 'cause I'll be back on my feet someday. I don't care if you do, 'cause it's understood. You ain't got no money, you ain't got no good. Well, I guess if you say so, I'll have to pack my things and go. That's right, hit the road, Jack. Don't you come back no more, no more, no more, no more. Hit the road, Jack. Don't you come back no more. Hit the road, Jack. Don't you come back no more, no more, no more, no more. Hit the road, Jack. Don't you come back no more. 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 That's right.
Okay, I'm back. Jano Orate is watching. Hi, Jano. Thank you for watching and for your support. I send my love in regards to the family. Ito si Jano pa. Family friend ko na ito. I've known them since I arrived dito sa Pilipinas, no? Hindi pa may mga... Si Burns Sales is Ocreto is watching. Hi, Burns. Thank you for watching. Si Maria Monica Aguilar. Hi, Monica, thank you for watching. Saka si Chris Armas Gabon Longara is watching. Hi Chris, thank you for watching. Okay. Hindi lang. Okay. May mga messages na tayo nagpadala sa akin. Let's get to the first question of the night, no? Before I do that, I'd like to say good morning to Esther Abad and also to Divina Russell and Alfred Natividad, mga friends ko ito, college friends sa USA, California, LA, California. Okay. May first question na rito na pumasok, no? Okay. Good evening, Doc Yammie. My name is Albert at taga Quezon City po ako. Lagi ko po kayong pinanonood at I've learned so much at marami kayong natutulungan. At marami na rin nanonood ng mga friends ko sa iyo. Well, thank you very much, Albert, mga taga Quezon City. Good evening to you all. Ang tanong dito ni Albert is, what does anxiety attack feels like? What does anxiety attack feels like? Ano daw ba ang pakiramdam na magkaroon ng anxiety attack, no? Albert, ang feeling ng anxiety attack is you may have the feelings of impeding doom or shortness of breath, chest pain, or a rapid or fluttering or pounding heart or heart palpitation. No? This kind of panic attacks or anxiety attack may lead to worrying about things happening again and again or avoiding any situation in which they have already occurred. No? Yung mga bagay na paulit-ulit natin iniisip na nangyari na, naganap na, pero paulit-ulit pa rin iniisip natin. No? Yan ang mga nararamdaman natin, chest pain, palpitation, mabilis ang tibok ng ating puso. No? I hope I was able to answer your question, Albert of Quezon City. Again, Albert, mga taga Quezon City, good evening to you all. And also to Digna Villarason is watching. Hi Digna, thank you for watching. Also say hello to your family and also to Bayani. Si Ron Dinyaga Rosacina is watching. Hi Ron, thank you for watching. Okay. Next question here is, galing to kay Carol of LA, California. Okay? Ang tanong dito ni Carol is, what happens during anxiety attack? Ano raw ba nangyayari pag during anxiety attack? Before I answer that, Carol, good morning to you all, mga taga-LA. And also, good evening to Richelle Zamora. Thank you for watching. And also, kay Esther Abad. Hi, Esther. Thank you for watching. Okay. What happens during anxiety attack? Well, during an anxiety attack, people may experience overwhelming panic, no? Fear, loss of control, chest pain, trouble breathing, and other signs of multiple worries. No? Anxiety attack can also occur during our everyday life. No? It could also be fleeting or it could persist and build through the day. So yan ang nangyaya, nabubulol ako sa Tagalog ko. That is what's happening during anxiety attack ng isang tao. Okay? Thank you mga taga-LA and good morning to you all. Good evening, Doc Yammie. My name is Jeffrey. I'm from Denver, Colorado. More power to you, and my friends and I are watching you always here. Our question is, usually how long can anxiety last? Okay, how long can anxiety last? Okay, before I answer that, mga taga Denver, Colorado, good morning to you all. And Jeffrey, thank you for your question. Huh? How long can anxiety last? Anxiety attacks typically last no more than 30 minutes, multiple times a day. No? With the symptoms reaching their most intense at about halfway through the attack. Anxiety can build up for hours or even days before the actual attack happens. No, so it's important to take note of factors that contribute to the anxiety to be effectively prevent or to treat them. No, bago pa tayo magka-anxiety attack, nararamdaman na ng tao yan days before. So, just be aware kung ano nag-trigger sa attack mo na yon. Bakit ka nagka-anxiety? Take notes, di ba? Pero usually, typically, no more than 30 minutes, multiple times a day, with the symptoms reaching their most intense, no? And about halfway to the attack. Okay? I hope I was able to answer your question, Jeffrey of Denver, Colorado. Okay. Okay. Good evening, Doc Yami. My name is Kobe. Taga Washington, D.C. po ako. And thank you for helping out and reaching out people. Well, it's a pleasure, Kobe. And again, mga taga Washington, D.C., good morning to you all. Tanong dito ni Kobe is, okay, what triggers an anxiety attack? Ano rin nag-trigger sa isa para magkaroon tayo ng anxiety attack, no? Um, a common trigger of an anxiety attack are an upsetting or stressful health issues, no? Such as chronic illness, certain medications such as birth control pills and cough syrups, no? Negative thinking, especially when you're upset or frustrated or in a frustrated situation, no? Worries about personal finances, relationship issues, family issues, job insecurities, um, unexpected bills that you have no control over it, um, love issues, sex issues. Yan ang mga nagtitrigger para magkaroon tayo ng mga anxiety attacks. Yan lang, isa sa mga factors ang nagkakos ng anxiety attack ng isang tao. Okay? Again, thank you for your message. Good evening, Doc Yanni. My name is Jenny. Taga San Francisco po ako at I'm with my family right now watching you. Well, thank you, Jenny, mga taga San Francisco. Good morning to you all. Actually, I have a college friends dyan sa San Francisco, si Alfred Natividad. Kung gusto niyo ng an excellent accountant, message me at bibigay ko number niya sa inyo. He's very good and reasonable in pricing, no? Ang question dito ni Jenny of San Francisco. Okay. Can you can you give can you give me a few coping strategies when I'm feeling anxious and how to prevent or how to cope up with my anxiety? Okay. Again, basahin ko nga ito ulit. Can you give me a few coping strategies when I'm feeling anxious and how to prevent or to cope up with my anxiety? Okay. Okay, can you give me a few coping strategies when I'm feeling anxious and how to prevent or to cope up with my anxiety? Okay. Jenny, itong pwede mong gawin, no? How to cope up and how to prevent, no? Try this when you're feeling anxious or stressed, no? One is take a time off. Take a time off, no? Practice yoga. Listen to music. Relaxing music, no? Meditate. Get a massage. Learn relaxation techniques like breathing exercises. Stepping back from the problems and will help you clear your head. Huwag mong isipin yun. Relax. Put it behind you. Second is eat well. Eat well-balanced meal. Do not skip any meals. Do keep a healthful, energy-boosting snack on hand always. Kung nagsisigarilyo ka man or anyone, limit smoking and alcohol and caffeine, which can usually aggravate anxiety and can trigger a panic attack. Get enough sleep. Makaramihan sa atin puyat, no? O 2 hours, 3 hours of sleep lang. Kasi when stressed, your body needs additional sleep and rest. So get enough sleep. Exercise daily. This will help you feel good and maintain your health. Take a deep breath. Sabi ko, inhale and exhale slowly with a count. What I mean with a count is take a deep breath, inhale, exhale, and exhale with the 10 counts. Slowly hanggang maabot mo yung to number 1 or number 10. It depends on how you start from 10 to 1 or 1 to 10. Sabi ko, count slowly, repeat, and ulitin mo ito to 20 times if necessary for 5 minutes. Um, do your best, no? Instead of aiming for perfection, which isn't possible. Walang perfect na tao eh. Be proud of however close you get to your goal, no? Accept that you can't control everything. Hindi lahat ng bagay kaya natin maging positive at maging in favor sa atin, no? Put your stress in a perspective way. Uh, it is really bad na kung isipin mo na mas yung stress mo, it's so stressful. Hindi yun eh. Put it aside. You may think it's bad, but it's not. Um, welcome humor, no? A good laugh goes a long way. Nga, sabi nila, avoid being too serious at all times. Relax. Maging jolly ka. Maging palabiro ka. Don't take things seriously. Maintain a positive attitude. Kasi this will make an effort to replace the negative thoughts with the positive ones. Um, get involved, like for example, sa mga volunteer or find another way to be active in your community. Kasi it can create a support network and gives you a break from everyday stress or issues. Ano ba? Learn what triggers your anxiety. Kagaya nga sinabi ko kanina, tingnan mo ano yung trigger sa anxiety mo, no? Or sa lungkot mo or sa panic attack mo. If it's work-related, love-related, family, school, or something else that you can't identify. Write a journal. Sulat mo your feeling of stress or anxious and look for a pattern. Kung makikita mo naman doon kung ano ang mas madalas ka sa ang bagay ka na stress o nagkakaroon ka ng panic attack or anxiety attack. Most importantly, no? Talk to someone. Tell a friend or friends, family, that you're feeling overwhelmed. Let them know how they can help you. Talk to a physician or therapist for professional help. Okay, I hope I was able to answer your question, no? And again, mga taga San Francisco, good morning to you all. Okay. Message ito. Good evening, Doc Yammie. Taga Venice Beach, California po ako. My name is Gary. Oh, hi, Gary, mga taga Venice Beach. Good morning to you all. Tanong dito ni Gary, how can I calm my anxiety fast? How can I calm my anxiety fast? Ano ba calm sa Tagalog? How can I calm my anxiety fast, no? Gary, here are some helpful actions, no? Or tips na lang that you can try na when you feel na nagkakaroon ka ng anxiety attack, na gusto mo siyang mapa-calm down. Okay? O, siguro ang Tagalog ng calm down is mapa-relax. Okay? First is take a deep breath with a count, sabi ko nga, that to relax you, no? Kasi once you take a deep breath with a count and do it slowly, this will relax you. Hindi mo siya mapapansin at first pero eventually, it will relax you. You know? Admit that you are feeling anxious or angry. Aminin mo. And assess mo kung bakit. No? Challenge your thoughts. To be able to relax your mind and emotion. Kung nararamdaman mo na stress ka, i-challenge mo. Tell yourself na everything's okay, I'm not stressed. And relax your mind and your emotion. Do something else para maiba yung takbo ng utak mo. Release the anxiety or your anger by saying, sabi ko nga, by saying, I'm okay, I will be okay, and everything will be okay. Always say that. Every time na nagkakaroon ka ng panic attack or anxiety attack, look at yourself in the mirror and say it slowly and take a deep breath. I am okay, I will be okay, and everything will be okay. Kahit every morning, pagising mo sa umaga, pagtingin mo sa sarili mo, sabihin mo yon every day. And I guarantee you, as time goes by, it will relax you and everything will be in a positive outlook sa iyo. Visualize yourself being calm. Ano pa ba? Think it through. Your concerns at the moment, if it's worth worrying, no? Kasi minsan tayo, we tend to think things paulit-ulit. Niworry natin isang bagay, pero it's not worth worrying. Walang ka, ano ba yun? Walang ka sense. It's not, walang ka torya para i-worry natin yung bagay na yun. Okay? So, let it go. Listen to relax. Listen to your body and relax by listening to a relaxing music that you enjoy, classical. Not anything hard or loud. Anything, yung mga sa mga spa music, ganyan ang mga pakinggan mo, classical, instrumental, um, meditation music. Um, Change your focus to something positive. That will make you happy or relaxed. What I mean by that is if you like dogs or you like watching a movie or whatever, do that just to break the feeling of anxiety. Okay, I hope I was able to answer your question. Si Janice Laungayan Donatus watching. Hi Janice, thank you for watching. Okay. Ito, message tayo dito. Magandang gabi, Doc Yammie. Ako'y taga Mandaluyong. Ang pangalan ko po ay si Jean. Maraming salamat po sa iyong mga tulong. Well, it's a pleasure, Jean. And also mga taga Mandaluyong, good evening to you all. Ang tanong dito ni Jean is, can my anxiety be cured? Pwede daw bang magamot ang anxiety? Can my anxiety be cured? Anxiety is not a curable illness. But there are ways to keep it from being a big problem sa ating buhay, no? Getting the right treatment for your anxiety will help you go back or dial back or to your old self. Pagka yung worries mo is beginning to be out of control na. What you can do with this is, I highly suggest to you to go to or have a continuous counseling, psychotherapy counseling. It will be a big help or a big solution in helping you with your anxiety attack or panic attack, no? People may not feel or think na counseling or psychotherapy is helpful, though, but it is. Through time, eventually, you will be less stressed, no? Yung iba kasi, once they see a therapist, ang unang-unang tinatanong is, gagaling na ba ako in 2 sessions, 3 sessions? No, you will not, or they will not. It will take time. Sabi ko nga, it's not a curable illness, no? It can be, maintain. Pwede mo ma-maintain, ma-hold yung anxiety mo, no? You can take control of it. You can take control of it by going to a psychotherapy counseling. Ito, continuous to. It depends how long it will take para malaman mo how to handle your stress. I hope I was able to answer your question, Jean of Mandaluyong. And again, good evening to you, mga taga Mandaluyong. Hindi, meron pa ba rito? Ang dali lang. Okay. Tagapandakan po ako. Magandang gabi, Doc Yami. Pangalan ko po is Leonard. Lagi ko po kayong pinanunood. At marami na rin ako mga friends na nanonood sa inyo. Okay, well, thank you very much, Leonard. Mga tagapandakan, good evening to you all. Tanong dito ni Leonard, can you beat anxiety without medication? Can you beat anxiety without medication? Yes. um, a mindfulness meditation is an effective anxiety treatment without um, medication. No? It works so well that some psychotherapeutic methods are based around this. No? Many therapists, like myself, use the mindfulness based cognitive therapy to help our patients or help patients with their anxiety. No? Siguro nagtataka kayo, ano nga ba ang mindfulness meditation? No? A mindfulness meditation, it is a type of meditation in which you focus on being intensely aware of what you're sensing and feeling at the moment without interpretation or judgment. Practicing a mindfulness involves breathing methods, guided imaginary, and other practices to relax your body and mind, and that will help reduce stress. Okay, and if you go to a psychotherapist, they will teach you the process on how to do this, no? Different process on how to do this. Okay, thank you very much. Leonard from Pandacan. Again, mga taga Pandacan, good evening to you all. Okay, tingnan ko dito. Good evening, Doc Yami. My name is Anton from UK. Hi mga taga UK, good morning to you all. Ang tanong dito ni Anton is, can anxiety happen to anyone for no reason? Okay. Can anxiety happen to anyone for no reason? Pwede daw ba mangyari ang isang anxiety na walang dahilan, for no reason at all? Okay. Anxiety can be caused by a variety of many things. For example, no, stress, genetics, brain chemistry, traumatic events, environmental factors. Symptoms can be reduced with anti-anxiety medication or psychotherapy. Again, it can be reduced by anti-anxiety medication or psychotherapy. Okay? But even with medication, people may still experience some anxiety or even panic attacks at times. So I would suggest that psychotherapy, counseling, tuloy-tuloy yan, twice a month. Once a month, eventually it will end up once a month. Pero at first, twice a month, depende kung how intense yung anxiety attack ng isang tao. Okay? I hope I was able to answer your question, Anton, at mga taga-UK. Good morning to you all. I will play a song. May mga question pa tayo sa isa kong cellphone o sa messenger ko. While I do that, I will play another song. Dali lang. Sabi dito ni Esther Abad, good evening, Doc JR. Esther Abad here, watching from LA. Hi, Esther. Tawag niya sa akin JR because college years namin, way, uh, way back sa LA, California, um, ang tawag nila sa akin is JR because me and my dad has the same name. So, naging junior ako eh. No? So, ang tawag ng iba sa akin is JR. No? Sabi rito ni Esther, really nice talking to you guys the other day with Didi, Alfred, and with you. Yes, it's a pleasure. Um, I really enjoy that, Esther, and someday soon, I will be going back to LA again and live there. Okay? Sabi nga na, there's no place like home. Si TJ Rondolo is watching. Good evening po, Doc Yammie. Hi, TJ. Attorney TJ Rondolo. Thank you for watching. Saka si Burns Sales Ocreto sabi, what happened to your live po? Well, minsan kasi napuputol, no? Pero just wait. Depende sa internet, eh. Minsan sa connection, medyo mabagal. Si K. Diaz Pacific, K. Diaz Pacifico is watching right now. Sabi niya, how will you know if you have anxiety and should we seek medical help immediately? Okay, paano mo malalaman, no, kung meron kang anxiety? Well, as I said earlier, if you tend to think of the same thing over and over again, na yung mga nakaraan mo na nangyari na, paulit-ulit mo pang iniisip, or you keep on thinking of things in the future na hindi pa nangyayari at nagwo-worry ka na, to a point na hindi ka na makatulog, sumisikip na ang dibdib mo, chest, no? Nagtitremble ka na, pinapawisan ka na every time you think about it, hindi ka makakain, naapektuhan na yung everyday routine sa buhay mo, then I would suggest immediately seek help. Pwede naman magamot ito eh. I mean, ma-maintain mo, ma-control mo by going to a psychotherapist. Counseling, no? Sabi ko nga, at first, your counselor may suggest twice a month para just to monitor you. Kasi kung once a month, it's way too long para ma-monitor ka eh. Twice a month, then eventually when things goes well, magiging once a month na yun. Depende sa iyo yun eh. Depende kung how you are responding sa therapy or sa counseling. But I would highly suggest kung nararamdaman mo na ito, then seek help for therapy. Okay? And huwag kang mahiya. Lahat tayo nagkaka-anxiety and there is no reason bakit mahiya ka o matakot ka pumunta to a psychologist and ask for help. It doesn't mean na there's something wrong with you talaga. It just sometimes yung therapist kasi or the psychologist is just a third person to help you, to guide you, to open up your mind. In a way na maintindihan mo ang bagay na mismo tayo o mga kaibigan natin, hindi natin na-explain. Okay? I hope I was able to answer your question, Kay. Diaz Pacifico. Okay. Okay, may tanong dito. Good evening, Doc Yammie. Taga-Australia po ako. My name is Ben. Hi, Ben. Mga taga-Australia, good morning sa inyong lahat. Okay? Lagi ko po kayong pinanunood at mga family ko rin nanonood sa inyo lagi. More power to you and for us. Sabi mo nga, this is our show. Yes, this is our show, Ben. Ang tanong dito ni Ben is, can anxiety go away by itself? Pwede daw bang mawala ang anxiety by itself, no? Anxiety can have such a serious impact on our health, no? It's important to get help. Sabi ko nga, sa isang caller natin, KK, it's important to get help. Mild anxiety may go away on its own or after the event causing the anxiety. is over, no? But ang chronic anxiety often persists and may get worse through time. What is a chronic anxiety, no? Well, a chronic anxiety, which is also called GAD, again, GAD, which stands for generalized anxiety disorder, or GAD, para mas madali, no? Is marked by excessive or exaggerated anxieties and worries about everyday's life and events for no obvious reason. Paulit-ulit, excessive, exaggerated feelings of anxiety, worries mo, sobra na. Sa araw-araw, na wala namang reason bakit maging excessive ang worries mo sa isang bagay na yon. People with these symptoms of generalized anxiety disorder, which is called GAD, tend to always expect disaster, no? Can't stop worrying about their health, their money issues, their love life, their family, their work, their school. Lahat na lang ng nangyayari sa buhay nila may problema. Lahat na lang ng situation negative. Everything is negative and everything has a problem, no? At walang solution to everyone. Kaya, to every situation na nararamdaman nila. Kaya, kung nararamdaman nito, then get help. Immediately get help. Okay? I hope I was able to answer your question. Ben from Australia. Okay, tingnan ko ito. Good evening, Doc Yammie. My name is Damien. I'm from Singapore. What is the main type of anxiety? I like your show. Keep it up. Well, thank you very much, Damien, mga taga Singapore. Good morning to you all. What is the main type of anxiety? Ano raw ang main type of anxiety? Um, the main type of anxiety is generalized, ang tawag dito is a generalized anxiety disorder, nga, no? Which is GAD. GAD is the most common type of anxiety disorder, no? The main symptoms of GAD is excessive worry about different activities or events. You may feel anxious a lot of times, or you are suffering from, or pag ganito, you are suffering from GAD, no? You might feel or on the edge, and pwede ka rin maging hyper alert to your surroundings. Lahat na lang, excessive, lahat na lang, it's a big deal, okay? Yan ang masasabi ko, main type of anxiety, which is the GAD. I hope I was able to answer your question. Damien of Singapore. And again, thank you for your message. Si Mirasol Esconde is watching. Hi Mirasol, thank you for watching and thank you for your support. Good evening, Doc Yammie. Ako po si Clairton, taga Vancouver. Well, hi Clairton, mga taga Vancouver, good morning. May mga family ako dyan, kamag-anak ko, mother side sa Vancouver. Kung nakikinig man kayo, nanonood din, good morning to you then. Ang tanong dito ni Clairton is, how do I know if I suffer from anxiety? Okay, paano doon niya malalaman kung siya is nagsasuffer from anxiety? Okay, may nagtanong na rin ito, pero again, sasabihin ko, no, I will answer your question, Clairton. If your worry is hindi mo na makontrol, no, uncontrollable, and causes you distress. Kaiisip mo hindi mo makontrol and nagkakasa ng distress sa yon. When your worrying affects your daily life, including school, sex life, love life, family relationship, your job, your social life, if you cannot let go of your worries, no? If you worry about all sorts of things that hindi mo naman dapat i-worry. Um, Worries about your job or health, and minor concern such as household chores, yung mga pinoproblema mo pa din. Yan na diyan mo na malalaman na you are suffering from anxiety attack. Okay? I hope I was able to answer your question. Okay. Good evening, Doc Yammie. My name is Vivian. I'm from New York, USA. Hi, Vivian, mga taga New York. Good morning. Ang tanong dito ni Vivian is, what are the worst symptoms of anxiety? Ano raw ang pinaka-worst symptoms of anxiety? Okay. Well, Vivian, the worst symptoms of severe anxiety and panic attack are usually fast heart rate, mabilis ang tibok ng puso, fast breathing, mabilis ang paghinga natin, excessive sweating, nausea, yung iba dyan nasusuka o naduduwal, trembling and feeling weak sa mga tuhod natin o naghihina tayo, um, being unable to move or run away, hindi tayo makagalaw, nakaupo lang tayo sa isang tabi, sa isang lugar, hindi tayo productive. Yun ang mga symptoms of anxiety, basic symptoms siya, no? Which, pag naramdaman mo niya, go seek help. Okay. Good evening, Doc Yammie. I'm from Chicago. My name is Lloyd. Hi, Lloyd, mga taga-Chicago. Good morning to you all. Tanong dito ni Lloyd is, does at what age do panic attack starts? Anong age daw ba nagsisimula ang isang panic attack ng isang tao? Panic disorder, Lloyd, no, a panic disorder is twice as common sa babae as it is in men. Symptoms often begins before the age of 25, but may occur in the mid-30s. Children can also have panic disorder as early as 6 years old of age, but it is often not diagnosed until they are older than 6. Okay? Again, thank you, Lloyd, for your question. And again, Chicago, good morning to you all. Okay. Okay. Magandang gabi sa inyo, Doc Yammie, taga Quezon City po ako. Ako po si Susan. Hi Susan, mga taga Quezon City, thank you for watching. No? Good evening to you all. Ang tanong dito ni Susan is, what are there different types of anxiety? Meron daw ba iba-ibang klaseng type of anxiety? Yes, no? Anxiety levels are typically classified as or classified by the levels of distress and impairment na experience ng isang tao at nalalagay ito sa 4 categories, no? One is mild anxiety. Second is moderate anxiety. Sunod, severe anxiety. And lastly, panic level anxiety. Okay, so ano nga ba ang mild anxiety? Mild anxiety is a manageable anxiety without any additional techniques, no? That you can still get through your day without panicking. You can enjoy your social life, and you can even find a hobby and activities na mag-enjoy ka, no? Yan ang mild anxiety na stress ka ngayon, pero later on, wala na. Kalimutan mo na, no? Pag sinabi naman nating moderate anxiety, no, the person becomes nervous or agitated. In moderate anxiety kasi, the person can still process information, solve problems, and learn new things. But with assistance from others, no? They cannot function or they cannot think well or wisely without the assistance ng ibang tao. Okay? Yan naman ang moderate anxiety. Pag sinabi naman natin severe anxiety, frequently naman ito having intense, excessive, and persistent worries and fear about everyday situation. Often, severe anxiety disorder involves repeated episodes of sudden feeling of intense anxiety and fear or terror that mga terror that reach a peak within minutes, no? Agad-agad. Okay? Nagkakaroon sila ng panic attack. It can also cause a rapid heart rate, um, palpitation, chest pain. Ito yung mga nararamdaman. And you may also be at an increased risk of high blood pressure, heart disease. If you already have a heart disease or anxiety disorder, kung meron ka ng heart disease, yung anxiety disorder natin may raise the risk of coronary event or issues. Okay, I hope I was able to answer your question. Susan of Quezon City. So again, we have the mild, moderate, severe, and panic level anxiety. Okay. Next one. Good evening, Doc Yammie. Taga Quezon City po kami. At kasama ko po ang asawa ko nanonood. My name is Kathleen. Hi, Kathleen. Again, Quezon City, good evening. Tanong ni Kathleen, can we have 2 panic attacks in a row? Can you have 2 panic attacks in a row? Kung pwede rin tayo magkaroon ng 2 panic attacks na magkasunod o in a row, no? Multiple attacks of different intensities may occur over several hours, no, Kathleen? Which might feel as if one panic attack is rolling into the next. Like waves, no? At first, kasi, panic attacks usually seems to come out of the blues lang, no? But over the time, a person may come to expect them in a certain situation. Okay, I hope I was able to answer your question, Kathleen of Quezon City. Okay. My name is Bob. Good evening, Doc Yammie. I'm from Long Beach, California. Hi Bob, mga taga Long Beach, California. Good morning to you all. Ang tanong dito ni Bob is, can anxiety damage your heart? Can anxiety damage your heart? Bob, people with anxiety disorders have inappropriate ups and downs, no? Feelings that can cause high BP, heart rhythm disturbance, or heart attack even. A malfunctioning stress response promotes inflammations, which can damage the artery linings of the heart and sets the stage of build-ups sa ating coronary line. Okay. I hope I was able to answer your question. Bob of Long Beach, California. Again, mga taga Long Beach, good morning to you all. Okay. Good evening, Doc Yammie. My name is Joy of Taguig. My question is, are there different types of anxiety attack? Meron daw ba iba-ibang klaseng type of anxiety attack ang isang tao, no? Yes, there are, no? Ang mga different types of anxiety attacks are spontaneous or uncued panic attacks. Okay? Ibig sabihin nito is, it occurs without warning, no? Out of the blues nga, no? No situational or environmental that triggers this or associated with this attack. This type of panic attacks may even occur during sleep hours, no, natutulog tayo, no? Susunod naman is what we call situational bound or cued panic attack. Ito naman occur upon the actual or anticipated exposure to a certain situation. This situation becomes cues or triggers for a panic episode, no? Example na lang, a person who fears enclosed space may experience a panic attack when entering or thinking about entering an elevator. Okay? Yun ang isang example ko. Uh, Isa pa is situational predisposed panic attack. Okay? Ang situational predisposed panic attack, ito ay attack that doesn't always occur immediately upon exposure to a feared situation or cues, no? But the person is more likely to experience an attack in such situation. For example natin dito is a person who has a fear of social situation, no? But does not experience any panic episodes in every social situation, or who experienced a delayed attack after being in a social environment for an external period of time. Okay. Yun ang different types of anxiety attack. Dali lang. Okay, see here. Good evening, Doc Yammie. Ako po si Paul at taga Sacramento, California po kami. Okay, hi Paul, mga taga Sacramento, California. Good morning to you all. Ang tanong dito ni Paul, what are the different types of anxiety disorder? Ano raw ba ang different types of anxiety disorder? No? One is what we call generalized anxiety disorder, which sinabi ko kanina is the GAD. It's an anxiety disorder characterized by a chronic anxiety, exaggerated worries and tension, even when there is little or nothing to provoke it. Next is what we have, obsessive compulsive disorder. Itong obsessive compulsive disorder is what we call OCD. It's an anxiety disorder, and it is characterized by recurrent or unwanted thoughts or obsession or repetitive behavior or compulsion ng isang tao, no? Repetitive behavior such as hand washing, counting, bilang ng bilang, checking or cleaning madalas, often, yung paglinis nila is yung minuminuto. Kalilinis na ng 5 minutes, maglilinis naman after 10 minutes. Yung mga ganon. Checking or cleaning sa isang bagay na yun lang ang nililinis niya, paulit-ulit na yun. Yung iba pinababayaan niya. Preventing, pag ganito, then definitely itong obsessive compulsive dito paulit-ulit, he or she is not aware of it, no? I know someone na obsessive compulsive na hinuhugasan niyang kamay niya paulit-ulit. Siguro, binilang ko kasi, no, in a 10-minute span, nakasampung beses siya maghugas ng kamay, no? Sabi ko, it's a repetitive behavior such as hand washing, no? Counting, checking, or cleaning are often performed with the hope of preventing obsessive thoughts or making them go away, no? Performing so-called ritual, tawag natin yung however naman, provides only temporary lang naman relief and not performing them markedly increase anxiety, no? ng isang tao. Okay, isa pa masasabi ko is panic disorder. Panic disorder is extremely anxiety disorder that is characterized by unexpected or repeated episode of intense fear accompanied by physical symptoms. No? That may include chest pain, heart pain, palpitation, and shortness of breath, nahihilo, dizziness, and abdominal distress. Okay. Okay. Um, ang susunod naman dito, ano pa ba? Post-traumatic stress disorder. Ang post-traumatic stress disorder naman is what we can call PTSD. Again, PTSD. Post-traumatic stress disorder. Itong anxiety disorder nito can develop after exposure to a terrifying event or ordeal in their life in which grave physical harm occurring or was threatened. No? A traumatic event that may trigger include violent, personal assault, human-caused disaster, accident, and military combat. Okay? Um, Pwede rin susunod is the social phobia. Pag sinabi ng social phobia, no? Or pwede rin sabing social anxiety disorder, no? Itong social phobia or anxiety disorder is an anxiety disorder characterized by overwhelming anxiety or excessive self-consciousness in everyday social life situation. Social phobia can be limited only one type of situation, such as a fever or a fear, a fear of speaking in formal situation, or ang tawag dito, a fever or a sense of feverish fear na natatakot silang express ang kanilang nararamdaman, whether it's in a professional way or unprofessional way, or eating or drinking in front of others, no? Or in its severe form naman, maybe so broad that a person might experience symptoms almost any time that they're around people. Ito yung mga social phobia, yung mga takot sila makipag-usap, takot silang makipaghalubilo, takot sila express ng sarili na sa tao, takot sila, limited ang function nila as an individual to a point na they have their own world. Yung mga ayaw nilang makiharap sa tao. Okay? Yan ang mga different types of anxiety disorder, Paul. Okay? Mga taga Sacramento, good morning to you all. Okay? Tingnan ko pa rito. Dali lang, water break. Okay. Next question is, good evening, Doc Yammie. My name is Barbara. I'm from Vegas, Nevada. Hi, Barbara, mga taga Las Vegas. Good morning to you all. Tanong dito ni Barbara is, what's the difference between panic attack and anxiety attack? Ano rin pagkakaiba ng panic attack and anxiety attack? No? The difference between panic attack and an anxiety attack is that a panic attack is usually sudden and over quickly. Natatapos agad eh. And an anxiety attack naman usually builds up, no? And it is long lasting. Both panic attacks and anxiety attacks uh, cause you to feel intense, can cause you to feel intense, overwhelming emotions, anxiety disorder that can cause people to try to avoid the situation that triggers or worsen their symptoms. No? Job performance, schoolworks, personal relationship can also get affected. Okay. Next one. Good PM, Doc Yammie, taga Manila po ako. My name is David. Hi David, mga taga Manila, good evening to you all. Ang tanong dito ni David is, how can people manage anxiety or stress? How can people manage anxiety and stress, no? Um, Sabi ko kanina is, you take time out, no? You eat a wealthy balanced meal, huwag ka mag-skip ng meal, eat well, limit alcohol and caffeine, get enough sleep, exercise daily, take a deep breath, count 1 to 10 slowly, do your best. Instead of aiming for a perfection, which hindi posible, it's not possible. Be proud of however close you get to your goal. Importante doon na tapos mo, you tried your best, no? Accept that you cannot control everything in life. Um, Alam, isipin mo na lang to, lahat tayo, we can't control everything. So you have to accept it. Okay? Welcome humor. A good laugh. Sabi nga nila, maging jolly ka. Kung may mag-joke, accept it. Huwag kang ma-offend. Um, get involved. Sabi ko rin yung kanina, yung mag-volunteer work ka. Do a project. Okay? Tapos, alamin mo yung kung saan nagagaling yung anxiety mo, trigger mo, para ma-assess mo. Tapos, importantly, talk to someone. Express how you feel kung nalulungkot ka. It's very important, no? Set small daily goals. Gumawa ka ng goals sa sarili mo na attainable naman. Huwag naman yung goals na super hard, no? Kasi may stress ka. Something attainable, everyday gumawa ka. Find form of exercise. Mag-gym ka, mag-workout ka sa bahay, even jumping jacks, push-up, sit-ups, importante naka-relax, nakapag-exercise ka. Sunod is distract yourself. Kung sa tingin mo, na-stress ka na, o nagkakaroon ka na anxiety attack, the best thing to do is distract yourself. Iwanan mo yung ganung situation and do something different that will keep your mind occupied, no? Sunod is recruit. Recruit an experienced body, which mean naman dito is, it is often easier to seek help from not a family member, but to friends, partner, or colleagues, no? Minsan mas mahirap din pagka sa kanila ka humingi, no? Minsan mas mabuti pa kung sa ibang tao. Lastly, no, be patient. When you start a new exercise, a program, most secondary people requires about how unique, di ba? Um, People kasi require about 4 to 8 weeks to feel coordinated, no? So, be patient. Um, Pag nag-exercise ka, wag mo madaliin, no? Um, it takes a few days para masanay ka eh, to feel coordinated, to be sufficiently in shape so that exercise feels easier. Kasi pagka minamadali mo isang bagay, madali kang frustrate. Then, nasa isip mo, unconsciously, ang hirap pala nito. Hindi ko kayang gawin to, so be patient. Okay. I hope I was able to answer. Ang dami nun ha. Yung tanong mo, I hope I was able to lay down yung mga different, different types, no? And how to manage anxiety or stress. Okay, next one. Ano pa? Okay. Si Amped Amorsolo is watching right now and Ricardo Lasso Jr. is watching. Hi Ricardo and Amped, thank you for watching. Okay, let's see here. Okay. Bago ko mag-ano ng ating conclusion, I will play a song.
Feelings, nothing more than feelings. Trying to forget my feelings of love. Teardrops rolling down on my face, trying to forget my feelings of love. Feelings, oh, feelings. I wish I'd never met you, boy. You'll never come again. Feelings, oh, feelings. Oh, feel you again in my arms. Feelings, feelings like I never lost you, and feelings like I never had you again in my heart. Feelings for all my life, I'll feel it. I wish I'd never met you, boy. Again in my heart.
Okay, I'm back. I'd like to say good evening. Nanonood dito si Mike Perez. Hi Mike, thank you for watching. Hi Doc, good PM. Good PM to Mike. And also kay Tita Liz Espiritu. Estela Espiritu is watching. Hi Tita Liz, miss you. Ito, isa to sa pinakamahusay na tumatahi, no? So, kung kailangan nyo ng tumatahi ng damit or anything, under the sun, kaya niyang gawin. Just message me, bigay ko yung number niya. Taga Cavite siya. Okay? Pwede. Saka si Marisol Escondes watching. Good evening po, Doc. Good evening. Okay? My conclusion for our topic tonight, no, anxiety. Anxiety is a normal reaction to stress and can be beneficial in some situations. It can alert us to danger and even help us to prepare and to pay attention to it. Anxiety disorder differ from a normal feelings of nervousness or anxiousness, and it involves excessive fear or anxiety. Anxiety disorder are the most common of mental disorder, and it affects nearly 30%, no, of adults at some point in their lives. But anxiety disorder are treatable, and a number of effective treatments are available, no? Such as continuous psychotherapy. Itong treatment na ito, this treatment help most people lead to a normal productive lives. As I said earlier, experiencing occasional anxiety is a normal part of our life. However, people with anxiety disorder frequently have this intense, excessive, and persistent worry and fear about their everyday situations. Often, anxiety disorders involves repeated episodes of sudden feelings of intense anxiety and fear of terror that reach a peak within minutes, which is known as panic attacks. These feelings of anxiety, or what we call panic attacks, will interfere with our daily activities uh, that are difficult to control, are out of proportion to the actual danger, and can last a long time. We may avoid places or situations to prevent these feelings. Symptoms may start during childhood or the teen years and continue into adulthood. Whatever form of anxiety we have or you may have, continuous psychotherapy treatment will be a big help and support to your situation. There are several types of anxiety ngayon. There are the agoraphobia, which this type of anxiety is disorder in which you fear and often avoid places or situations that might cause you to panic and make you feel trapped, helpless, or embarrassed. Next is anxiety disorder due to a medical condition. Includes symptoms of intense anxiety or panic that are directly caused by a physical health problem. Next is the generalized anxiety disorder, which is the GAD, includes persistent, excessive anxiety and worries about activities or events, or even ordinary events, routine issues. The worry is out of proportion to the actual circumstances, and it is difficult to control, and it will affect on how you feel physically. Um, this often occurs along with other anxiety disorder or depression. Next is the panic disorder. Involves repeated episodes of sudden feelings of intense anxiety and fear or terror that reach a peak within minutes, which we call panic attacks. Um, we may have this feeling or impending doom, shortness of breath, chest pain, or rapid fluttering or pounding heart known as palpitation. These panic attacks may lead to worrying about them happening again and again, or avoiding situations in which they've already occurred. Uh, Another one is the selective mutism. Selective mutism is a consistent failure of children to speak in a certain situation, such as school, even when they can speak in other situations, such as at home with close family members. This can often interfere with their school, their work, their social functioning day to day. Um, Next is separation anxiety disorder. Ito naman is, this is a childhood disorder characterized by anxiety that excessive for the child developmental levels, and related to separation from parents or others who have parental roles sa bata. And we have the social anxiety disorder, or what we call social phobia, which sinabi ko kanina is this involves a high level of anxiety of fear and avoidance of social situation due to a feeling of embarrassment, self-consciousness, and concern about being judged or viewed negatively by others. Sunod naman is the specific phobias are what we call phobias that are characterized by major anxiety when you're exposed to a specific objects or situations and desire to avoid it. Phobias kasi provoke panic attacks in some people. Substance in Substance includes anxiety disorders then is characterized by symptoms of intense panic attack or anxiety that are direct result of misusing drugs or taking medication, being exposed to a toxic substance, or withdrawal from drugs. Once you are experiencing symptoms like you feel like you are worrying too much, interfering with your work, relationship with others, with your family, with your life, takot ka, anxiety, upsetting you, day to day, depressed, nagiging alcoholic ka, nagiging drug user ka, nagkakaroon ka ng mental health concern along with your anxiety. This is the time for you to seek help, and as soon as possible, para makontrol mo yung feeling of your anxiety level. Okay? There is no way to predict for certain what will cause someone to develop an anxiety disorder, but you can take steps to reduce the impact of the symptoms if you are anxious, um, by going to a therapist, and or by get early help, stay active, avoid alcohol or drugs use. Um, Anxiety sa mga bata is usually by trauma. Children who endured abuse or trauma or witnessed traumatic events are a higher risk of developing anxiety disorder at some point of their life. No? Um, Let us remember na don't let your mind bully your body into believing it must carry the burden of its worries. No, never let life hardship disturb you. No one can avoid problems. Um, Nothing is chaotic as it seems. Nothing is worth your health. Nothing is worth poisoning yourself into stress, anxiety, and fear. Get humor, or a good humor is a is a tonic cure for mind and body. It is the best antidote for anxiety and depression. It attracts and keeps friends, and it will lighten human burdens. It is a direct route to serenity and contentment. Okay. Again, thank you all for your continued support. Please like and share to all your friends about Let's Talk with Doc Yammie Santos live streaming para we can all continue to support and guide and help people with clinical and mental health issue and stress issue, no? Um, Sabi ko nga, life is full of reasons to enjoy, to suffer, to fight, to give up. But there's also reasons why life is so beautiful. It is when you live life with honesty, respect, dignity, understanding, patience, sincerity, and God-fearing, which all answers to unconditional love to one another. We are never too old or too late to always set another goal in life or to dream a new dream every day. Hope is a renewable option we have. If we ran out of it at the end of the day, we can get start over again in the morning, sabi ko, or the next day. Um, Let us be more caring, have more empathy toward each other, respect, and most importantly, have faith in God. Let us all appreciate, love, and cherish one another. Our loved ones, our family, and the world that we have now. Let us all be in one team. Okay? Let us all take extra care and value our essentials. That is letting us survive nowadays, especially with this pandemic. Sometimes in life, we make a choice, and sometimes these choices are the ones that makes our life. We are the choices we make. God gave us two gifts. One is a choice, and the other one is a chance. Let us choose to have a good life and a chance to make it the best of us for everyone, for the wonderful life we have now. Again, I will always be a kapamilya to everyone. Thank you all for listening and watching. Again, my daughter, Matia Isabel Santos, would like to say good morning, good evening, and good afternoon to all. Say hello to everyone. Okay, say hello to Tita Esther and Tita Bibi and Tito Alfred.
Hello, Tita Esther, Tita Titi, and
Tito
Tita
Alfred.
Tita.
And Tita Litz is watching right now.
Hello.
Okay. Again, assistant ko yan. Siya tagabigay sa akin ng mga nagme-message. Again, shalom to all. Good night. And I hope to see you next week again for our next topic. And thank you again. And please like and share my YouTube channel para tuloy-tuloy tayo makatulong sa mga tao. No? Again, this is our show. Good night. Bye.